Hi, welcome to YouTube my channel. My name is Nurjaman from Segmajin Kunakonoma. Today I am going to speak about MRI. What is MRI test? What is MRI test? MRI test, MRI magnetic resonance imaging, is a non-invasive and painless procedure in medical imaging technique that uses strong magnetic field and radio wave to create detailed images of the insides of the body. It is used to visualize soft tissue structures such as organs, muscles, tendons, ligaments, and the brain. It also does not use ionic radiations as used in X-ray and CT scan, making it safer than other imaging techniques. Why to perform MRI scan? MRI scan is performed to diagnose and monitor a wide range of medical conditions including neurological disorder, musculoskeletal injuries, cardiovascular disease and cancer. It is particularly used for imaging soft tissues such as the number 1 brain, spinal cord, muscle, tendons, ligaments, and internal organs. MRI is also commonly used to diagnose and monitor a wide range of medical conditions, including number 1. Brain and spinal cord disorder, such as multiple sclerosis, tumors, and infections. Number 2. Joint disorder, such as arthritis and torn ligament. Number 3. Heart and blood vessels problems such as blockage and aneurysms. Abdominal and pelvic disorders such as tumors, inflammations, and infections. Breast cancer screening and evaluations. Prostate cancer screening and evaluations. Before the procedure, before the MRI procedure, patient will be asked to remove any metals objects such as jewelry and should inform the healthcare provider if they have any metals implant such as pacemaker, artificial joint or cochlear implant such they have affected by the magnetic field. Patients may also be asked to first or avoid certain foods or medications prior to the procedure. Here is one note. It is important to follow any instructions provided by your healthcare provider to ensure a safe and successful procedure. During the procedure, during an MRI, the patients lie on a movable table that slides into a large tunnel-like cylindrical scanner. The machines create a strong magnetic field that aligns the protons in the body tissues. Radio waves are then used to create signal from these protons, which are processed by a computer to create detailed images of the body internal structures. Patients undergoing an MRI will need to lie still during the procedure to avoid blurring of the image. In some cases, a contrast agent may be injected into the patient's veins to help enhance the visibility of certain structures in the image. After the procedure, if you haven't been sedated, you can resume your usual activities immediately after the scan. Notes: MRI is generally safe, but some patients may experience claustrophobia or discomfort during the procedures. In some cases, contrast agent may be used to enhance the image, which may use allergic reactions or other side effects in the same patient. Risks in MRI. While MRI scans are safe for most people, there are some risks associated with the procedure. Patients with certain type of medical implant, such as pacemaker or any others made up of materials other than titanium, may not be able to undergo a procedures. Claustrophobia patients may find the enclosed space of MRI mechanic to be uncomfortable or stressing. MRI and comparisons to CT and X-ray scan. Unlike X-ray and CT scan, MRI scan do not use ionizing radiation, so they are considered as safer options for some patients. Both MRI and CT computer tomography scans are medical imaging techniques that provide detailed imaging of the body internal structures. However, there are some key differences between the two. While both techniques can provide highly detailed images of the body, they use different technologies to do so. CT and X-ray to create image, while MRI scan use a combination of strong magnetic field and radio waves. This means that MRI scans do not use ionizing radiation, which can be harmful in high dose. CT scans are generally faster than MRI scan. A CT scan can typically be complete within a minute, but an MRI scan can be take anywhere 30 minutes to over and half an hours depending on the area of the body being imaged. Each technique has different role when it comes to imaging certain parts of the body. CT are particularly used for imaging bones, and X-ray are better and penetrating dense tissue. MRI scans, on other hand, are better for imaging soft tissues like the brain's muscles and organs. Risks in CT and MRI. There are some risks associated with both techniques. CT scans are ionizing radiations which can be increase the risk of cancers over time. MRI scans, on the other hand, can be uncomfortable for some patients due to the enclosed space of the machines, and patients with a certain medical implant may not be able to undergo the procedure. Overall choice between CT and MRI scan will depend on the patient's individual's need and area of the body being imaged. In some cases, both techniques may be used together to provide a more complete picture of the patient's condition. Thank you.